Dr. Buck, I want to move on to America's opioid crisis because
Sure.
it's tightening its grip on teenagers. After years of decline, teen deaths from drug overdoses are now on the rise. The death rate of adolescents between the ages of 15 and 19 overdosing on drugs has more than doubled from 1999 to 2015. This is according to new research from the CDC. Researchers say opiates were the chief culprits behind this spike. You said you see patients like this every day, but we talk about potential solutions, but what do you think is one way to attack this?
You know, it's a really difficult problem. I think a lot of people say, okay, we can give, there's a couple medications out there. There's methadone, there's Suboxone, Subutex, which are kind of a long-term or a longer dose. Instead of heroin is a fast-acting, a quick acting medication, so you give these other longer acting medications, but you're trading one drug for another, and so that's not really a great situation. So the best thing for these teens is really counseling and habit change.
Doctor, do you think overprescription comes into play? I was a lieutenant in the NYPD,
okay,
and I've seen oftentimes you had people that would prescribe these opioids, and they sold them on an open market. And do you think that that comes into play in terms of doctors overprescribing and possibly monitoring the doses that these people are given?
That's certainly a consideration, and I think that does happen. Overall, I don't think that's the biggest problem. You know, we had basically in the late 90s, we started using pain as our fifth vital sign, and so we started treating pain as much as possible. And then early in 2000, the FDA came out and said, hey, these medications, OxyContin, oxycodone, they're not, if they're written as a prescription, they're really not addictive. And so, a lot of, at that time, a lot of doctors said, okay, well, this is great. We can give these pain medications out and not worried about our patients being addicted. And then in the mid 2000s, we started having these surveys, The JCO did these surveys, these patient satisfaction surveys, and they then coupled that to reimbursements. And so then you have a big problem with, hospitals and doctors saying, well, geez, if my patient is not satisfied, as in they don't have, they have a lot of pain, they're going to say, I'm not satisfied, so let's satisfy them by giving this pain medication, and then we'll be reimbursed better. So this is like, the perfect storm we're talking about for this.
And doctor, parents need to be careful. Point blank, now we're getting the word out, but you should not keep these prescriptions at home, and if you have them, you need to hide them.
Right.
You need to hide them from your kids because it's very
so this is the biggest problem with the kids. They get hold of these. They don't get prescriptions usually, and they often don't go out and get them on the streets. The kids really get them usually from somebody they know. So that's our for the adults, that's our lesson, is keep these medications safe.
Dr. Buck Parker, thank you. Dr. Buck, come back soon, please.
Okay.